Update on my health. Um, I have been eating less. I cut out the candy, as I said last week. I have been eating just enough to feel full. Now there are days when I fail, like 1 or 2 days that I failed and did probably eat more than I should have. But it has made the world of difference. I still don't completely fit in behind the wheel, but instead of having to lean the chair all the way back like I had to do that day, I just need to put it a little bit back. I can get the seat belt to go around me now, but still, I'm still having trouble reaching the gas pedal. So, because my belly hangs so low, it gets in the way of me closing my legs, and so that doesn't mess up my leg. I have poor circulation, so it starts to spasm something terrible sometimes. You stretch it out, but still. Um, I've been able to walk a little bit better without feeling really out of breath. Just like the 2 days I probably overate. Those days I had a little bit of trouble breathing. Um, and walking because it hurts so bad. Um, I've been looking up the symptoms online, and there's so many things that these symptoms could be. One of them being ovarian cancer. I didn't see hernia. Several people said they had the same symptoms, and they wrote me and said that it was a hernia. So I didn't see that. But there's just so many different things that said it could be ovarian cancer, irritable bowel syndrome, which I don't know about that. Just I can't remember. Just had a good 3 or 4 different things it could be. Um, but anyway, those are the two that stood out in my mind. So, but I'm feeling, like I said, I am feeling a little bit better, thank God. And I just need to continue to eat less. Like as soon as I feel my stomach starting to feel full, I have to stop. The times when I went over is I was picking all day. I was like afraid to eat like a meal. I was just picking all day, and like I would eat something every half hour as opposed to eating a meal and then waiting 2 hours. They say people get hungry every 2 to 3 hours. That's why people snack. Kudos to people who can only eat 3 meals a day without snacking. I would go to bed with a stomach ache and wouldn't be able to sleep if I did that. But just cutting your portions down, and I haven't been doing the walking thing. Actually, I relaxed, and that also made a world of difference. I just chilled out. Like for 2 days this week, I did nothing but relax. I didn't even cook dinner, which is bad, because then that's when you pick more at night. Um, but yeah, and that I think that did a world of good for me too. So I've been doing a little bit better. But I know some people say go to the emergency, go to the emergency room. Um, Emergency is and sometimes it could even be too late. But I mean, I've done this so many times already with my kidneys. You go in, they ask you how much pain you're in. If it's not something that feels a priority, you could be there literally all day or all night, which they probably wouldn't find me a priority because it only hurts after I eat and when I walk. And basically, and I even read it online when I was looking at the symptoms, all they do is give you painkillers and say go to your doctor. And I don't have insurance. And like I said, one of my credit cards is almost maxed out. Um, so at least it's my own credit card, and that one's all maxed out because that's the one I used for the move and for the car, and it would do me no good. What happens is you get like a $7,000 bill, and they do nothing for you, and they send you to your doctor. Unless I'm like bleeding or something that they would have to perform some sort of emergency surgery, they will do nothing for you. And I was reading it too. People were talking about the symptoms online, and that's the same thing they do to them. Go to your doctor. That's what they do. So it really, really doesn't do me any good. It's just gonna put me deeper in the hole. Um, and like I said, my credit card is like almost maxed out. So I don't know. I don't know what I'm gonna do as far as that. But all I can do is pray. and you know, I don't know, maybe Obamacare will kick in. I don't know. It's a catch-22 though, because you can't afford to pay for insurance because it's so expensive, like $600 to $800 a month for a family, and yet for you to get free health care, and I've asked people in countries that have free health care, basically they take it out of your check anyway, and you have a lot less to live on. So it's a catch-22, but I want to live, so let's see how that goes. I don't know, what's going to happen with that. But I'm pretty sure I need surgery. I'm pretty sure, whether it's the hernia or whether it's the cysts. I think it's the cysts in my ovaries. Um, you know, I'm pretty sure I need surgery. Um, so yeah,